Hi, my name is Dr. Siobhan Graham and I'm a general practitioner in Northern Ireland with an interest in sport and exercise medicine and an interest in posture and well-being and strengthening your muscles just to improve your overall health from the inside to the muscles on the outside to your skin to everything. So today we're talking about shoulder pain, in particular shoulder impingement. If you don't know what shoulder impingement is, just think of it as nipping of the muscle or impingement of the muscle just in under this bone here. So this is called the acromion. It's part of your shoulder blade which sits at the back here. And the shoulder blade extends right up over here to the top of your arm. There are three main causes that I think of when I'm talking to patients about shoulder pain. The first is within the shoulder joint itself, so right up in the socket, and we tend not to see a lot of osteoarthritis in the socket of the joint, and that's because we don't use our arms as weight-bearing limbs. We use it just to lift light things generally. We're not pushing a lot of pressure up in through the joint like we do in the hips or through the feet or through the knees. So osteoarthritis of the joint. So it's a ball and socket joint. It's a very shallow socket, so instead of a socket cupping the top of the arm, so this is the top of the arm here, it's quite shallow, it's like a saucer, okay, and it's the muscles then that come down around the top of the joint that really support it. So people that get osteoarthritis within the joint is anybody that has had a fracture, like myself, within the joint. Sorry, something's just popped up there. And that would be probably one of the main causes. And as you age, so you'd really be in your 70s or 80s, or if you had a predisposition to osteoarthritis, where it's inherited, and you might have it in your fingers, your elbows and your knees, but we tend not to see it a lot within the joint. Where we do see it is what's called a bony spur just here on the edge of the acromion, and that often we think comes from poor positioning of the shoulder blades. So that's the second cause. The first cause within the joint, second cause poor posture. So this is bad posture. You can see the neck is coming forward, the shoulder blades are rolled forward. What you want to do is take the shoulder blades back and down into your pockets, okay, bringing the tummy in, chest out, and the head elongated. You want to lift the chin up too far, so you're looking at the sky. Just want to have a nice neutral gaze, as if you're cupping an apple just in here, okay. So that's a nice posture, shoulders open, chest open, really just relaxing the arms down at your side. So if your posture is bad, if your shoulders are coming rolled over, you're always working in front of you at a computer, maybe cutting hair, maybe pulling things. I had a guy recently who is a tire fitter, has his own business, an awful lot of working right in front there, and the shoulder blades are coming right forward. The muscles at the front are getting tight, muscles up here are overactivated. And what really happens here is you start to overuse the trapezius muscles, unfortunately. You stop using the rotator cuff muscles and they become weak. And as the rotator cuff muscles become weak, what happens is the head of the top of the arm, that's the humerus, goes further up into the socket. And as you start to lift the arm up to do your normal daily work, you get impingement, so you get nipping of this muscle that comes down here, and sometimes you get nipping of the muscles underneath as well. So that's the second cause. First cause is osteoarthritis within the shoulder joint. Second cause is poor posture with the shoulder blades coming forward, and with that the associated bony spur. And the third cause then is referred pain. So we always have to think of referred pain. So where could it come from? It's not in the shoulder, it's not a bony spur, it's not impingement. Is it coming from the neck? So is there a disc in the neck that's pushing on one of the nerves that comes down to the shoulders? You might have pain around the back of the shoulder, around the top of the shoulder. You might have it down into the arm. Okay, so you want to always get checked out by a doctor or a physical therapist, somebody that knows about these different causes. And the fourth cause, there's a fourth cause, would be inflammatory arthritis. So arthritis elsewhere in the body. You might have swollen finger joints. Inflammatory arthritis tends to affect the knuckles here and these knuckles, so osteoarthritis tends to affect these, although it can have a similar picture sometimes. So you think of the knuckles, the feet might be sore as well, and it tends to affect both sides. So if you've a possibility of inflammatory arthritis with a family history, if you're feeling tired, if you've swelling of the joints elsewhere, get checked out straight away, because there's great treatments out there now, along with looking at your diet and all sorts of other things. But go and see a doctor straight away, don't be afraid of that. So that's the four causes. Sorry, I started off with four causes of shoulder pain. So what can you do about shoulder pain? There's lots of things you can do about it. I mentioned posture. Number one, posture, getting the shoulders back and down. So if that's your shoulder blades, you want to get them back and down into the pockets, okay, of your trousers. That's the first thing. Activating your core. This is part of a kinetic chain, so from the feet up through the core to your arms. Whenever you're using your shoulders, you need a good strong core. If your core's weak, if you're overweight in the tummy, get working at your core. I can recommend bridging, leg raises, look it up online. Lots of exercises there. So that's the first thing, starting with your core. Second is posture. Look at your posture in the mirror every day, whatever you're doing. Always think of your posture, get the shoulders back. Okay, so I'm a surfer, haven't surfed in a little while because I've had a second child, but bringing the arms forward, always getting tight in the pec muscles. So what we want to do is loosen up these muscles. One of my favourite things is the massage ball, or a lacrosse ball, even better, and just getting it into the pec muscles here. You can also stretch the pec muscles just in the doorway. So if you imagine a doorway here, this is the doorway. Maybe I'll just show it to you over here, it'll be easier. So this is a doorway or a window, and we're just leaning forward, and you can see I'm really stretching out the muscle just across here. Okay, leaning forward and then just looking around to the side. Alright, so that's a pec stretch, and you can do it on both sides. That's the right side. And the second stretch then is the muscle just up here. So we have a muscle called levator scapulae that attaches from the neck to the top of the scapula, and you want to really stretch that out as well because that gets tight. So if you can put the arm just onto your back pocket, tilt the head over, look into your armpit, and gently pull the head down very slightly till you feel a nice stretch. Okay, and just hold that. And the same thing, get one of these, get a lacrosse ball, and really massage in to these muscles, and you get instant pain relief. It's amazing, really is amazing. And I've been reading a wonderful book by Kelly Stark from America. I think he's from California, and it's called Becoming a Supple Leopard. So if you want to treat yourself at home, then buy this book, highly recommend it. And it's all about really getting into these muscles and then strengthening them once they're lengthened. So that's posture, loosening up these muscles. The second one is strengthening. So you want to keep these shoulder blades back. You don't have to remember about posture all the time. One way to keep them back then is to strengthen these muscles that hold the shoulder blades back. So the rhomboids in the middle trapezius, lower trapezius, muscles under the scapula called the serratus anterior that clamp the scapula down. And two of my favourite exercises are the wall push-up plus, which I'm going to demonstrate to you here. Actually, I can just do it here. So imagine that's a wall. So activating the core again, so the tummy's coming in. Okay, neck's nice and elongated, and you're just pushing up the shoulder blades together. Okay, and you're really getting into the shoulder joint there, getting into the joint of the scapula along your chest wall. So that's actually called a joint, but it's not a true joint. And you just do as many of these as you can. They're not tiring, so you can probably do 30. Might want to do 10 to start off with. So not letting the shoulders go up, but just straight back. Okay, and that's your push-up plus. So as many of those as you can do. Do 3 sets. We like to do sets of everything, and then you can progress those as you go. So the next exercise after the push-up plus then is the low row. And I didn't mention it here, but if you have impingement, so if you have a spur here, or if the shoulder blade is coming forward and you're nipping the muscles, impingement's always worse when you turn the arms inwards like this. So that's neutral. But when you turn the arms in or backwards, you take the big heavy part of the head of the upper arm, the humerus, and it clamps in onto the bone, whereas when you open out, you get the smaller head of the humerus in onto the joint, and you don't get as much impingement. So try and keep the arms always open all the time. So this is a low row, and I've got a TheraBand here. There's lots of different TheraBands with colours, which is quite good. So you can do it with the arms, elbows bent initially. Again, activating the core and bending the knees a little bit just to remind you to activate the core. Let's do it over here so you can see. And we're just going to start with the arms outstretched. Don't let the shoulders roll forward, so shoulders back and down. And then just bringing the arms back and doing it as a nice, slow, controlled movement. And again, maybe doing 10 repetitions, then another 10. And then on the final set, always pushing yourself. so that you really get the maximum reps you can get without hurting yourself, but just knowing your limits. So you might do 20 on the third set, you might do 15. If you do 15 on the third set, the following day, if you're going to do these again, and you start off with 15 again, then 15, and then the third set again, you increase it up, you progress it to your maximum number of repetitions. There's loads of ways to progress exercises. That's one of my favourite because I think it's easy. So that was your push-up plus and your low row, and that's getting the shoulder blades back. These are just simple exercises to start off with, okay? The next exercise is internal and external rotation, and you can do this with a band as well, but I like to do it on my side initially. A lot of physios will recommend this, so always put a towel in under here, gets the shoulder into a neutral position, okay? Better blood flow, to the shoulder, and you want to lie on your side and you just lift the weight up gently. So I'll show this. You can see me, so I don't know if this will work or not. So you're lying on your side. This is kind of on my side, you can see what I mean. And then you just lift the weight up. Now this is only half a kilo, so you can see it's fairly easy for me to do. So you probably want a kilo here. See how you go. If your shoulder's very sore, half a kilo might be enough. You know, to stimulate change, and that's what we're doing. Trying to stimulate change within the muscles, okay, that promotes healing. And as you get stronger, you know, your pain should decrease. Okay, so that's external rotation. And just keeping the towel here, as you see. And once you've done that for maybe a couple of weeks or so, you can change this up as you need to. So you take the TheraBand and you just do the internal external rotation this time, standing up. Okay, so I've doubled up on the band just to make it easy to show you. So just bringing the bands over like that. That's the external rotation. Again, core activated, bend your knees. I think you can see that. Shoulders back, and then just bringing that out to the side. So it's a bit hard with the two bands. It's external rotation, then you're coming around to the side like this. Okay, bending the knees, and we're doing internal rotation again, very gently. Okay, shoulders back, core activated. Probably need to come over just a little bit. There we go. So just nice and slow. Just bring it up, make that a bit shorter. So you do want the arm to be just out a little bit. If it's too close to you, you don't get much of a exercise, much movement. So I'm shortening the band over there and just pulling it across. And I find this quite difficult, this one. I can feel the shoulder clicking, but this is a great exercise to do. So that's internal and external rotation. And the final strengthening exercises that I hope you can see here are again with the weight. That's all you need. You can do this on your tummy. Now, let's see if I can turn this around. You're going to get a view of a very old bicycle here. So I'm just going to lie on my tummy, and it's going to look like this if you were looking at me from below. So it's called the T's. I'm just going to lift the arms up and back like that. Okay, pinching the shoulder blades, and then Y, so you're lifting the shoulders, the arms upwards. Okay, so I'll just try and demonstrate that down here. So just lying on the tummy. This is the Y to start off with, so lifting the arms up and keeping the shoulder blades back and down as best you can, activating your core. Okay, and then I'll just turn around and we'll do the T's. So the arms are at 90 degrees. And again, just lifting the arms up to the side, and they're pinching the shoulder blades together. And this should be tough. If you have impingement, this will be tough. I do recommend leaving the Y's till, a couple of weeks in. A couple of weeks of doing internal, external rotation, doing your push-up pluses, doing your low rows, then incorporate the Y's. And the reason is that when the arm goes above 90 degrees, even above sort of 80 degrees, once it gets in there, if your posture's not good and you haven't really got the strength built up as yet, you're going to get impingement when the arm's up here, and you might find that you're not improving very much. So that's a tip for you to remember. The other one is the pendular exercises. So if your shoulder's sore some days, this is great for pain relief. Don't grab a weight. I used to grab a weight all the time, but actually you're activating the muscles and you're not really getting the relaxation. So you lean on a chair and you just let the arm fall down like so. Show it to you on this arm. So you can see that. Yeah, so just letting the arm roll down, and you get lovely stretching of the shoulder, so the head of the humerus comes out of the shoulder joint. Let's do that on the other side as well. It feels really good. Okay, I think that is everything. So just to recap again, causes of shoulder pain are deferred pain from the neck, osteoarthritis within the joint, poor posture, sometimes causing bony spur here, causing impingement as the shoulders come forward, and inflammatory arthritis, which could have swelling of the joints elsewhere. They're the main causes. Treatment is posture, loosening up these muscles with a massage ball and a little bit of stretching, and then strengthening. If you don't do the strengthening, you're not going to get better. Other things that help, certainly in the beginning, are anti-inflammatory. So ibuprofen, for example, that's an early. Ibuprofen, 400 milligrams 3 times a day for a week or two. Don't take it if you've got a stomach ulcer or have had a stomach ulcer, obviously. But it does help for good pain relief, and that allows you to get on with the exercises. You can't take ibuprofen, even just paracetamol or acetaminophen, as they call it in America. But speak to your doctor if you're not sure. You can buy these over the counter, obviously. The other thing is a gel rub, so you can rub in an anti-inflammatory gel. But the same thing applies if you've had a stomach ulcer, or if you're on any blood thinning tablets. We wouldn't advise it at all. So a little bit of pain relief, get working on the exercises, and if you feel like you're not getting anywhere, get seen by a doctor, get seen by a physiotherapist. And sometimes you need a steroid injection, you know, if it is impingement, and that just settles down any swelling or inflammation, or if you have a bursitis, settles it down and allows you to get on with the exercises. And it really does help with a lot of people. It's not for everybody, of course, and certainly you can manage this yourself without any injections, just with exercise, just with posture realignment. If you have any questions, or if you like this video, please press the like button and leave some comments at the end. Okay, thank you and have a great day.